1, venous blood from the medial aspect of the forearm would characteristically enter the basilic vein and then next into which of these? Okay. So from the medial aspect of the forearm, and I'm talking about not the midline, that would be the median, all right, but the medial, so the little finger side of the forearm, would characteristically enter the basilic vein and next into which of the following? Draw it out.
Aspect of the forearm. It entered the basilic
Look at your
vein
diagram
next.
from Wednesday.
Oh, yeah, yeah. And then,
Break it over. Basilic, and then break it
or is it the,
Isn't basilic and brachial combined?
yeah, let's see.
Oh, that's right. That's why I'm confused. Okay, yeah, it's
Hey, we have an example with them today. You knew that already, right? It's a good thing. It's moving along. You're driving a little VW bug along the basilic vein. The next road you're going to drive into. Okay, before we move on to blood pressure and summarize up the last few weeks, we need to finish up with fetal circulation. Okay, we've talked about a few things. We've talked about the foramen ovale and the ductus arteriosus and their postnatal components. I'm going to kind of tie all that in together. And I'm going to give you a list of 5 fetal structures and what their 5 postnatal structures are called. They're pretty similar, so we've already talked about 2, foramen ovale and fossa ovalis, and the ductus arteriosus and the ligamentum arteriosum. So we'll come back and look at those along with 3 others. Anybody want more time on question number 1? Okay. So, one thing that we have to recognize, and I'm sure you all do, but I'm going to point it out anyway, is that the fetal lungs are not providing any oxygen to fetal blood. All right? They still need blood supply because they're growing and developing, and that needs to be established. We can't all of a sudden establish pulmonary circulation after birth. Whether it's used or not, it has to be established prior to birth. So we still have the right ventricle pumping blood via the pulmonary trunk to the fetal lungs, and it's returning to the left atria, but it's not picking up any oxygen. Okay, we're just maintaining that, those series of blood vessels. So the placenta is what's providing the oxygenation of the fetal blood. And remember how we determine whether it's a vessel, an artery, or a vein is its direction of flow and its pressure changes. And so this is the second situation where we have veins and arteries that are carrying, veins carrying oxygenated blood and artery carrying deoxygenated, okay? So let me just kind of trace you through this, what's going on here. And so we have, we'll start with the heart. We have the left ventricle pumping a mixture of oxygenated and deoxygenated blood. Because what's coming into the right ventricle is deoxygenated, and what's coming up from the inferior vena cava is deoxygenated, but it's mixing with the oxygenated blood from the placenta, so it's going to be a mix. And what's coming from the lungs obviously is deoxygenated, so it's coming into the left ventricle and being pumped out the aorta. So this really should be a reddish purple, not a bright red, and you can see that it is darker than the bright red coming from the placenta. Okay, but this is what the body gets. This is the oxygenated blood that goes to most of the body tissues, everything but the liver. So it comes down the aorta through the ascending arch, the arch of the aorta, thoracic and abdominal aorta, flows through common iliac and into internal iliac. And one of the branches of the internal iliac, there's a couple of branches that supply oxygenated blood to the bladder. One of the words for bladder is cysto, all right, another is vesicular, as it's kind of bladder shaped. So off of these vesicular arteries to the bladder, another branch from each one, left and right, then carries that blood to the placenta. It's a little bit of a misnomer because now we're calling it deoxygenated. It's the same content of oxygen that's going to go on down to the foot. It's the same kind of oxygen that's going out to the hands or that's going to the brain. But when we compare it to what's coming back from the placenta, it has less oxygen, okay? So in this sequence where it's going out to the placenta to pick up oxygen, we're going to call it deoxygenated. Although, as I said just now, in truth, it really has the same oxygen content as what we're delivering to the rest of the tissues. So and there's two umbilical arteries, something that when a baby is born and the umbilical cord is cut, that is checked. They can't do anything about it if there's not two umbilical arteries, but they can look for other congenital defects. So in the placental fetal capillaries of the chorionic villi, it'll pick up oxygen and give off the carbon dioxide that the fetus has produced, and then returning to the heart, meaning at a low pressure, a single vessel called the umbilical vein is going to carry the now oxygenated blood. So we have the pulmonary system, we have the pulmonary arteries going to the lungs, carrying deoxygenated, and pulmonary veins coming back, carrying oxygenated. Here we have umbilical arteries carrying what we call deoxygenated, and the single umbilical vein coming back, carrying oxygenated. Now, not only is it carrying oxygen, it's carrying nutrients. Because it's at the same site, it's going to pick up amino acids and simple sugars, all right, and lipids that the mother has digested and is in the mother's blood. So remember we looked at the portal system on Wednesday? And we had all of the absorbed nutrients in our bodies going to what organ first? The liver. Same thing happens with the fetus with the nutrient-rich blood from the placenta. It's going to go to the liver first. Okay? So from the umbilical cord, the umbilical vein is going to travel to the liver. Now it doesn't all have to percolate through the liver sinusoids. Okay? It can bypass the liver. So some of it will go through the liver, but most of it will not do so prior to entering into the inferior vena cava. So we have a structure for this connection between the umbilical vein to the inferior vena cava that bypasses the liver, and this is called the ductus venosus. So we had a ductus arteriosus up here we'll talk about in a moment. This is the ductus venosus that lies it's a connection between the umbilical vein and the inferior vena cava, bypassing most of the liver tissue. Now, at that point, it's been oxygenated, 100% oxygen, but now it's running into and mixing with the deoxygenated blood coming from the lower limbs and the abdominal organs, which is deoxygenated, at 40% oxygen, okay? And so here we have a mixture. And we'll talk about when we get to the respiratory system, we'll talk about how the fetus can develop with that low content of oxygen. It has to do with fetal hemoglobin and how the affinity for fetal hemoglobin, but for now, it works. As it comes through the inferior vena cava, it comes in at such an angle that most of it shoots through that foramen ovale. And so most of this blood is going to enter the left atrium. The flow of deoxygenated blood, completely deoxygenated blood coming from the superior vena cava is going to drag some of that with it into the right ventricle, which is a good thing because the lungs do need some oxygenated blood. All right, so now the right ventricle is going to pump out the pulmonary trunk, and it's going to go to the right lung and the left lung, which because of the fluid filling up the alveoli is under higher pressure. It's harder for the right ventricle to pump the blood to the lungs than it is for the left ventricle to pump the blood to the body. And that's because all those alveoli are filled with fluid that we talked about the very first day of the cardiovascular system, when we're comparing fish and frog and human hearts. So, because of that, we have another connection here between the left pulmonary artery and the aorta called the ductus arteriosus. And so, because it's more difficult for the blood to continue going to the lungs and under lower pressure if it were to go to the aorta, some of that is going to leave the left pulmonary artery and be added to the arch of the aorta. And that structure is called the ductus arteriosus. Okay? But there's still going to be some going to the lung tissue. All right, so let's diagram this out. I don't have a purple dry erase pen, so I'm going to be using red and or blue when I should be using purple. Now let's diagram this out, and we'll start with what we're going to consider to be oxygenated blood, leaving the right ventricle. Ah, here's the purple. That'll help. So leaving the left ventricle, and this should really be a reddish purple, maybe I'll overlay it with red just so we have a mixture. So we're considering this to be oxygenated blood in the aorta, but it's not as oxygenated as it would be in the umbilical veins. So let's label those structures. I'm just gonna write the names out rather than putting numbers. So we have the ascending aorta. The arch of the aorta. And I'm not drawing in all the additional vessels. Thoracic aorta. We have our diaphragm, so down here would be the abdominal aorta. All right, and then the abdominal aorta divides to form the common iliac and gives off the internal iliac, forming the external iliac. So I'll just label common iliac and internal iliac, since we're not worried about the blood flow going to the external. Again, we're leaving the heart, so these are still considered to be arteries, transporting the oxygenated blood to fetal organs. And off of the internal iliac, we have vesicles known as the vesicular arteries, okay? I'm not gonna draw it in there, but specifically we have the inferior vesicular arteries. Vesicular meaning urinary bladder. And this is going to give off the branch, which is the umbilical artery, all right? So you don't need to identify inferior vesicular for lab, but for lecture, I want you to know that that's the source for the umbilical artery. And that's going to rise from the pelvis and come up to the umbilical cord. All of you still have those pair of vessels, the umbilical arteries, okay? So let's diagram them coming over here to the placenta. And because they're arteries, they're got more muscle, they're a little bit more tortuous, curvy. So they're gonna come up to the umbilical cord. And again, they haven't lost any more oxygen than what is going to continue on down to the lower limbs. But in contrast to the blood that is returning to the fetus, we now consider this to be deoxygenated. It's just a change of terms, okay? We haven't really changed the content of the vessels at all. So these are the umbilical arteries. So this blood is considered to be oxygenated. But this blood in the umbilical arteries would be considered deoxygenated, okay? capillaries exposed to the maternal lacuna blood, we have a single umbilical vein. All right, so 2 umbilical arteries, a single umbilical vein, and that's going to return via the umbilical cord. And I'm filling it in solid just so you can kind of pick it out among all these lines. So it's called a vein because it's returning blood to the heart and therefore it's under low pressure. Otherwise, blood would not be flowing back to the heart. Okay? It's coming back to the umbilical cord, and now it's going to go up the liver as the umbilical vein. And then it's going to send a bypass. Some of it will go through the liver, but it will send this bypass to where it's going to empty into the inferior vena cava. Okay? So that bypass is identified when it's open as the ductus ductus venosus. And this is oxygenated. Okay, everybody with me so far? So now we're going to pick up deoxygenated blood in the inferior vena cava. I'm not going to draw the common iliacs coming together. We'll just look at the vena cava here. So inferior. Vena cava deoxygenated. I'm going to underline that to emphasize it really is deoxygenated. And I'm going to underline this to indicate it does have lots of oxygen. Okay? And now I'm going to draw purple because it's a mixture of oxygenated and deoxygenated. Okay? So we have a little bit of the inferior vena cava. I'm going to just move this over a little bit. Carrying a mixture of blood into the inferior vena cava, into the right atrium. Okay? Coming from the head and neck, upper limbs, we also have deoxygenated blood from the superior vena cava. And that is going to flow mostly through the right atrium into the right ventricle. Okay? Whereas our mixture of blood from inferior vena cava is going to flow through the foramen ovale into the left atrium. So we've got our left ventricle now is going to pump out the aorta, but we got to get our pulmonary trunk in here as well. And there's our ductus arteriosus. So I know I erased with my fingers and you guys are like, wait, we just have that there. But there are pictures, and I can put a link to that up online too. So, now that we have this on the board, let's follow it again, okay? So we have what we're considering to be oxygenated blood leaving the left ventricle and flowing into the aorta. We have deoxygenated blood leaving the right ventricle and flowing into the pulmonary trunk. Remember, our ventricles are going to pump at the same time. So from the left pulmonary artery through the ductus arteriosus, we're going to add some deoxygenated blood to our mostly oxygenated blood coming from the left ventricle. Okay? So that's our first or last, depending on what cycle you want to go into it, fetal structure there. Then the blood flows down the aorta, out the common iliacs, down the internal iliacs, off the inferior vesicular arteries into the umbilical arteries. And now we're calling it deoxygenated. It goes through a pair of umbilical arteries to the placenta, where it picks up oxygen and it returns to the fetus through the umbilical vein. Now it's considered to be oxygenated. Bypasses most of the liver via the ductus venosus. Mixes with inferior vena cava blood and flows into the right ventricle. Most of it going through the foramen valley into the left atrium. Deoxygenated superior vena cava blood will come into the right ventricle and is pumped out the pulmonary trunk and out to the lungs, except for the little bit that goes through the ductus arteriosus. Okay? I think the animated version is a lot easier to follow. So once you have that down, I'm going to erase what's on the whiteboard. Keep this animated version up, and we're going to list the 5 fetal structures and the 5 structures that they become after birth, typically within 3 days after birth. Okay? Does anybody want more time on the diagram? Or need a photo of it? Okay, so may I erase the whiteboard now? Thank you. All that work and it's gone. I get to do it again tomorrow. All right, so we'll put fetal structures up here on the left and postnatal structures over here. I used to call them adult, but you don't have to be an adult. They form within a few days after birth. So postnatal over here, all right? First ones we'll look at will be the umbilical arteries. Of which there are 2. When they collapse, and the reason they collapse is because the umbilical cord is cut and there's no more blood going through it. So it's similar to the way varicose veins are treated. And the varicose veins are treated with chemicals or with the laser. It causes them to collapse, they're not visible. Okay? So these structures are still present after birth, but they're no longer visible, no longer functional, but they're still there. And they're identified as medial, not median, medial, they're not in the very midline. Umbilical model that I use to show you the internal thoracic vessels. And these gray structures here in the vessels, so right at the midline is the median, which is the collapsed opening from the urinary bladder through into the urachus, into the amniotic fluid, and that's closed. That's the median. That's the one that's right in the very middle, which you don't need to know. Then we have the pair of medial, which are the collapsed umbilical arteries, and the laterals are due to these blood vessels here that we first saw when we were talking about whether an inguinal hernia was direct or indirect, and it kind of was on the medial or the lateral aspect of those. So those end up forming the lateral, although they're open, they're not collapsed. So the median and then medial are the two sets of umbilical arteries there. All right, then we have the umbilical vein. And when that collapses, it's identified as the ligamentum teres, which means round ligament, and we use that term in the female, but for some reason we hardly ever use that for this particular vessel. And this is way too big to be a healthy liver if it was normal size. And it's kind of a weird model because it actually fits against your posterior abdominal wall like this, and the stand is right in the middle of it, in the front of it, okay? But if we look in the back, here's the inferior vena cava. And here's the liver kind of partially growing around that. So here is the portal vein and hepatic artery carrying the blood we've been talking about into the liver. Here is the collapsed umbilical vein as it travels from the belly button, the umbilicus, up to enter into that same area. We need in the afterbirth, we need both the portal vein to bring our nutrients, and we need the hepatic artery to bring our lipid, oxygen-rich blood to the same area. We have all of that in the umbilical vein. After birth, we don't have any blood coming up through the umbilical vein, so that collapses and is known as the ligamentum teres. Okay? Then we have the ductus venosus. Because it's bypassing and emptying into the inferior vena cava, it's bypassing the liver and emptying into the inferior vena cava. So this is known as the ligamentum venosum. And we can also see that here as this band of white coming up and emptying into the top of the inferior vena cava there, okay? So this is what would have been if it was a fetal structure, this would be the ductus venosus. And once there's no blood flowing through it, it's the ligamentum venosum. So that would be this structure right here, coming up into the liver near where the hepatic veins still do. All right, then we have the two that we've already discussed, the foramen ovale, which is the fetal structure, and then after it's closed, the fossa ovalis. So that connects right atrium to left atrium, allows most of the blood in the inferior vena cava to bypass the right ventricle and the lungs. And then if it does happen to get into the right ventricle and get pumped to the lungs, our last bypass rather, is the ductus arteriosus, from the left pulmonary artery to the aortic arch. So it's emptying into an artery instead of into the vein. So this is known as ligamentum arteriosum. Okay. So here is a cut umbilical cord with the two arteries, which are small. Any idea why the arteries are smaller in diameter than the umbilical vein? Which one has more muscle? The arteries do, because they're under greater pressure, and when they're cut, they're going to be able to contract more as a reflection of that cut. So they contract down and provide a smaller lumen for the arteries. The umbilical vein has less muscle, so it's not gonna shut down as much, okay? This is just showing it's called the porta hepatis, where the hepatic artery and portal vein come in. So coming up from that area would be the umbilical vein, becoming the ligamentum venosum, and emptying into the inferior vena cava, we have the ductus venosus or ligamentum venosum. Okay, so here's what I just showed you on our model, and this is also showing ligamentum teres here, which our model does not show. So going from the umbilical cord up to the liver. We'll look at that again when we do the digestive system, okay, and we talk about the peritoneal mesenteric structure it travels in. Okay, anybody have questions on that? So lab will be identifying these structures. Lecture would be matching up postnatal to fetal. If in lab you choose a postnatal term when it's a fetal or vice versa, it's partial credit, okay? All right, so question number 2. The internal thoracic artery is a branch of the subclavian artery. The internal thoracic vein, however, drains into, because I said the word however, that should be a clue, it doesn't drain back into the subclavian. So now you have a 50-50 chance. Question?
When we're done with this, can you go back and show me the ductus arteriosus?
Yeah. From the animated one? Okay. All right, we're just going to step back here for a moment. So this is the ductus arteriosus right here, connecting left pulmonary artery to the arch of the aorta, okay? Did y'all have a good weekend? No? Too much work? Daddy? I got into a bit of a tiff with my son and daughter-in-law. Uh-oh. So Saturdays are about the only days I have to see my granddaughter, because I was at the office Sunday from 8 until 9, because they had an exam all day today at Sac State, and they have one on Wednesday. And so I always am polite. I texted my son and said, may I come over and see Brooklyn today? And he's like, well, she's at her other grandparents. So they left her there Friday night, and they didn't pick her up until Sunday at noon, which is like half a mile from here. And so I was like, well, he said, well, we're going to a soccer game. We're going to take her with us to a soccer game. So when we come down to pick her up, why don't we go out to supper at Chipotle? I said, okay, half an hour is fine. It's better. And then he called and said, well, we don't have any time, so why don't you come over to the bushes and see her for 10 minutes? And I was like, no, I'm not going to do that. Saying hi for her and then turning around and leaving is she's not going to understand that. So he said, well, if we don't do that, then we have to bring her over to your office and then take her back to the bushes. And I said, well, I thought she was going to the game with you. And he said, no, we decided it was too cold, so we're going to leave her at the bushes. My house is 5 minutes from their apartment. So I said, well, why don't I pick her up and drive her? But they don't want her coming to my friend's house. They haven't given her, his wife has not given her reasons. So I said, I've got a key, why don't I pick her up and take her back to your apartment? And then, she'll be there when you get home. He goes, oh, that sounds like a great idea. So 30 minutes later, he goes, well, we've decided to leave her at the bushes. So I was like, okay.
You need a grandbaby fix.
So I was like, ah. I was trying, I mean, I know it wasn't his idea, but he started talking it over with his wife, and she walked in while we were on the phone, and I said, okay, you guys talked it over and let me know, and it was just like, gotta watch my words here. Anyway, his mother-in-law posted on Facebook a picture of Brooklyn. And so I was like, I want to say something, and I did. So I posted it and I said, what a cutie. I'm so disappointed I'm so sorry I missed seeing you this weekend, or missed being with you this weekend. I thought, okay, that's not,
Thanks.
to me, it's being a bit cutty, but at least
You had to throw it out there.
I did. And his mother-in-law typed back and said, you're welcome to come over here and see her anytime she's here. Okay, I'm not gonna answer that one. All right, last one before we move on to blood pressure, and then we'll come back for two more. Deoxygenated blood from the anal canal flows to the inferior vena cava via all of the following vessels except. So there's one answer that is not utilized in returning venous blood to the inferior vena cava from the rectum. Anal canal, that's even more specific. Actually, let me say, instead of anal canal, that's being a little, I'll change it to rectum. I think that provides us a better choice of, fits all of the above but one. No, I gotta change it again. Yep, anal canal is best, the way I had it. Yeah, it reads better as anal canal. So what's the return? What's our, if we're tracing a drop of blood from the anal canal? It's gonna leave the anal canal via the, anal canal is the most inferior aspect of the rectum. So inferior rectal, and that's gonna drain into the internal pudendal, which drains into the internal iliac, which drains into the common iliac. All right? Which then drains into the inferior vena cava. So which one did I not use? What drains into inferior mesenteric? Superior rectum. Okay? All right, so I'm going to come back to this because questions 4 and 5 are still on blood vessels.